Hello, thank you for joining us for another session brought to you by the Society of Actuaries Research Institute. My name is Achilles Natsis, Health Research Actuary at the SOA. I am pleased to present key findings from our research report, HIV and Medicare, a survey of the HIV Medicare population, exploring the demographic composition and care needs of the HIV-positive Medicare population. So, let's get started. This report puts a spotlight on the HIV-positive population in Medicare, which has been steadily increasing due to the aging of the population with HIV. This trend is expected to continue over the next decade, with HIV becoming an even greater percentage of the Medicare population. We will provide some background on this population and then examine some key characteristics that distinguish HIV-positive members from the HIV-negative population, including demographics, medical costs, and pharmacy costs. The impact of an HIV diagnosis has changed dramatically since the disease emerged in the 1980s and really took off in the 1990s. In the early 1990s, an HIV-positive diagnosis was typically followed by rapid progression to AIDS with life expectancies of 1 to 2 years. Treatment options were very primitive with severe side effects. Limited understanding and social stigma made it more difficult for individuals suffering from this disease to get help. Fast forward to today, individuals with an HIV diagnosis have much more effective treatment options, including antiretroviral drugs that suppress the virus and maintain the immune systems of diagnosed individuals. Regular HIV screening and early detection allow for more effective treatments for individuals, resulting in a near normal life expectancy for many HIV-positive individuals. HIV is now considered a manageable chronic condition, and many individuals diagnosed with HIV are now eligible for Medicare coverage. Now, we will talk about some key demographic characteristics of the HIV-positive population in Medicare. First, the HIV-positive population in Medicare is quickly aging. In 2017, only 27% of HIV-positive individuals in the Medicare program were 65 or older. That number increased to 46% by 2022. The reason why not all HIV-positive individuals in Medicare are 65 and over is because many of them qualified for Medicare due to disability. At this point in time, most of the new members entering Medicare will be aging in on their 65th birthday. HIV-positive individuals in Medicare have two other predominant characteristics. First, they are overwhelmingly male. In 2022, 0.5% of males in the Medicare population were HIV positive, compared to only 0.13% of females. Income is the other key factor that correlates to being HIV positive. Dual eligibles are individuals who qualify for Medicaid due to their low income status, as well as for Medicare. In 2022, 1.05% of dual eligible populations were HIV positive compared to only 0.15% of non-duals. Next, we'll discuss medical costs for HIV positive members. Medical costs tend to be strongly correlated with the number of chronic conditions that an individual has. Individuals with more than one chronic disease are said to have comorbid conditions or comorbidities. Individuals with HIV tend to have more comorbid conditions present than those without HIV. In 2022, roughly 20% of HIV-positive individuals had no comorbidities versus 35% of those without HIV. Roughly 60% of HIV-positive individuals had 1 to 3 other chronic conditions versus 53% of those without HIV. Finally, 20% of HIV-positive individuals had 4 or more comorbidities, compared to only about 12% of those without HIV. Individuals with HIV and no additional chronic conditions have very similar costs to those without HIV or any other chronic conditions. Individuals with HIV and 1 to 3 additional chronic conditions have costs about 10% higher than those without HIV, but with 1 to 3 chronic conditions. Finally, for individuals with 4 or more chronic conditions outside of HIV, HIV-positive individuals had average costs that were about 25% higher. So the conclusion here is that as chronic conditions start to pile up, then HIV-positive individuals tend to have increasingly higher costs compared to individuals that don't have HIV. Lastly, the paper examined pharmacy costs of HIV-positive individuals in Medicare compared to the non-HIV positive. Total allowed annual pharmacy costs range from $3,000 to $3,400 per member per month for non-low-income HIV-positive individuals, which is about 10 times higher than pharmacy costs for individuals without HIV due to the costs of antiretroviral therapies. Low-income individuals tend to have costs that were about $300 to $400 higher per month for both HIV-positive and HIV-negative members compared to their non-low-income counterparts. However, low-income individuals did not have to pay any out-of-pocket pharmacy costs, so their financial burden was less than for non-low-income members. In conclusion, our research highlights the unique demographic and care needs of the HIV-positive Medicare population. It underscores the importance of tailored care management programs to address those specific needs and ensure adequate care for HIV-positive members in the Medicare program. Expansion of CSNPs, or chronic disease special needs plans, is one way in which a greater number of HIV-positive individuals could be managed. As more HIV-positive individuals age into Medicare, CMS and participating Medicare Advantage carriers that prepare to better engage with HIV-positive members will likely be more successful at meeting their unique needs and managing their costs. We welcome feedback, so please send us your comments or suggestions via email to research@soa.org. Thank you for viewing this video. This is Achilles Natsis, Health Research Actuary at the Society of Actuaries Research Institute.